Wilms tumor. Wilms tumor is an uncommon kidney malignancy that fundamentally influences youngsters. Otherwise called nephroblastoma, it's the most widely recognized disease of the kidneys in youngsters. Wilms tumor frequently influences kids ages 3 to 4 and turns out to be significantly less regular after age 5. Wilms tumor regularly happens in only one kidney, however it can some of the time be found in the two kidneys simultaneously. Throughout the long term, progressions in the analysis and treatment of Wilms tumor have incredibly improved the standpoint, visualization for kids with this infection. With suitable treatment, the viewpoint for most youngsters with Wilms tumor is excellent. Indications. Signs and indications of Wilms tumor differ generally, and a few youngsters don't give any conspicuous indications. Be that as it may, most kids with Wilms tumor experience at least one of these signs and indications. An abdominal mass you can feel. Stomach abdominal swelling. Abdominal pain. Different signs and manifestations may include fever, blood in the urine, nausea or vomiting or both, constipation, loss of appetite, shortness of breath, hypertension. When to see a specialist. Make a meeting with your kid's PCP in the event that you notice any signs or side effects that stress you. Wilms tumor is uncommon, so almost certainly, something different is causing manifestations, however it's imperative to look at any worries. Causes. It's not satisfactory what causes Wilms tumor, however in uncommon cases, heredity may assume a part. Malignancy starts when cells foster mistakes in their DNA. The mistakes permit the cells to develop and separate wildly and to continue living when different cells would kick the bucket. The collecting cells structure a tumor. In Wilms tumor, this cycle happens in the kidney cells. In uncommon cases, the mistakes in DNA that lead to Wilms tumor are passed from a parent to the kid. Much of the time, there is no known association among guardians and kids that may prompt malignant growth. Risk factors. Components that may expand the danger of Wilms tumor include African American race. In the United States, African American kids have a marginally higher danger of fostering Wilms tumor than offspring of different races. Asian American youngsters seem to have a lower hazard than offspring of different races. Family background of Wilms tumor. On the off chance that somebody in your youngster's family has had Wilms tumor, your kid has an expanded danger of fostering the illness. Wilms tumor happens all the more much of the time in kids with specific anomalies or disorder present upon entering the world, including aniridia. In aniridia, an iHRID-E, the iris, the shaded bit of the eye, shapes just halfway or not in the slightest degree. Hemihypertrophy. Hemihypertrophy, trim hello there pure true charge, implies one side of the body or a piece of the body is perceptibly bigger than the opposite side. Wilms tumor can happen as a feature of uncommon conditions, including WAGR condition. This disorder incorporates Wilms tumor, aniridia, genital and urinary framework anomalies, and scholarly incapacities. Dennis-Drash condition. This disorder incorporates Wilms tumor, kidney illness and male pseudohermaphroditism, pseudohermaphroditism, in which a kid is brought into the world with gonads yet may show female qualities. Beckwith-Wiedemann condition. Kids with this disorder will in general be altogether bigger than normal, macrosomia. Different signs may incorporate stomach organs that stick out into the foundation of the umbilical line, a huge tongue, macroglossia, developed inner organs and ear anomalies. There is additionally an expanded danger of tumors, including a kind of liver disease called hepatoblastoma. Prevention. Wilms tumor can't be prevented by anything you or your youngster can do. On the off chance that your youngster has hazard factors for Wilms tumor, like known related conditions, the specialist may prescribe intermittent kidney ultrasounds to search for kidney irregularities. Albeit this screening can't forestall Wilms tumor, it might help recognize the illness at a beginning phase.